I'm Bruce Marshall. This is the Brampton Now update for the May Victoria Day weekend 2021. Coming up, steady as she goes on the protocols from Peel's chief medic, a snapshot in pandemic time from the front lines of one of the biggest battles from 𝗕𝗿𝗺𝗺𝗃 Health CEO 𝗕𝗿𝗺𝗺𝗺. And while most of us get it, there are still those who don't get it and are participating in large gatherings. Authorities have a new way to deal with that. Beautiful weather for most of the long weekend. Full current Brampton forecast at the link in description. This is the Brampton Now update. Here's what's happening in Brampton. While talk of new protocols at the provincial level swirls on the big media outlets, when you drill down to the Brampton perspective, Dr. Lawrence Loh still urging that we don't undo the success that we have won so hard. The chief medic at the city's weekly press conference with advice about this holiday weekend. Steady as she goes with the protocols.
As I've said, transmission rates remain high, hospitals are still contending with capacity challenges, and variants continue to remain in our midst. We don't want to go backwards. So we need to continue to limit our contacts as much as possible, distancing, masking, and meeting outdoors only with those we do not live with for essential reasons, and not meeting if we're sick. I really urge you all, as we approach this long weekend, please maintain these measures across this long weekend so we can enjoy the other long weekends ahead in summer and be assured of that.
The other big story in the chief medic's world is the massive machine that has become the vaccination effort in Peel.
We have delivered over 850,000 vaccines in the region of Peel and have hit 60% first dose coverage of our adult 18+ population. Projected appointments indicate that we will hit our goal of 75% first dose coverage sometime next week.
The age ranges are opening up, as are more vaccination clinics.
With that capacity and continued supply, we opened yesterday to 16+ who live, work, and attend school in Peel. And as mentioned by Mayor Brown and Dr. Mohammed, tomorrow morning Peel Region will open appointments to youth 12 and older, 12 to 15, through our booking systems in accordance with ministry direction on hotspot eligibility and Health Canada guidance. Please visit peelregion.ca/COVID-19 vaccine to book online at any of our community clinics, and keep your eye out for continued mobile and community outreach offerings.
Do your part if you haven't already.
If you haven't done so already, please get your first shot. Now is the time. The vaccines are safe, they are effective, they prevent hospitalizations and mortality that continue to threaten lives in our healthcare system and continue to limit our interactions.
In a moment, Dr. 𝗕𝗿𝗺𝗺𝗺𝗃 is head of 𝗕𝗿𝗺𝗺𝗺𝗺 Health, who run both the hospital and the Peel Memorial Clinic. He told of a drama that unfolded in recent weeks as the hospital system has been dealing with a COVID emergency. Dr. Mohammed and the story of the 𝗿𝗺𝗺 frontliners, next on the Brampton Now update.
Is going to a party really worth it? Putting yourself at risk puts everyone at risk. Help limit the spread of COVID-19.
I've been to hundreds of car accidents within the region of Peel, leaving the scene knowing every one of them could have been avoidable. Please, take the pledge.
This is the Brampton Now update. I'm Bruce Marshall. Dr. 𝗕𝗿𝗺𝗺𝗺𝗃 spoke at the city's Wednesday press conference, and he has some sobering thoughts and statistics about what we've endured at Brampton Civic Hospital. Dr. Mohammed.
At the peak of Wave 3 in April, 𝗿𝗺𝗺 had more COVID-19 patients through its doors than any other hospital in Ontario. 𝗿𝗺𝗺 continues to provide care for a high number of COVID-19 patients as we speak.
Now, be reminded that this is against a backdrop of Brampton getting half the health care funding of the Ontario average. However, I would argue that one of our strengths through this has been the fact that we have a hospital system. It's designed to work together as a system. Dr. Mohammed seems to confirm that.
If there have been any shining moments through this pandemic, one of them would be the unprecedented level of collaboration amongst Ontario hospitals during this time. It's been truly inspiring.
And again, back to that half the health care funding that we get in Brampton playing a part, we set records for transferring people out of Brampton.
Over the course of the pandemic, we have transferred 1,125 patients to other hospitals. This is the most of any organization in the province. Without this process, we would be lost here in this region.
While not only providing care for those who come through the door with COVID, the Osler Health System is also running several of the vaccination clinics. Dr. Mohammed on that.
Last week, Osler opened a new vaccine clinic at Century Gardens Recreation Centre at 340 Vaudin Street East in Brampton. This site was made possible thanks to the City of Brampton and Brampton Fire and Emergency Services, who are helping to staff this new clinic.
In a moment, Regional Councillor 𝗕𝗿𝗺𝗁 on the bylaw situation. Most people doing what needs to be done. Small bands of selfish idiots, though, still gather, however. More on that next on the Brampton Now Update.
Canadians are dying of overdoses every day. Stigma is making it harder for people to get help. Addiction is a treatable medical condition, not a choice. Help end the stigma. A message from the Government of Canada.
There are some things you just don't do halfway. Fighting COVID-19 is one of them. As vaccines roll out, let's keep giving this our all and continue to follow public health measures. A message from the Government of Canada.
I'm Bruce Marshall. This is the Brampton Now Update. City and Regional Councillor 𝗕𝗿𝗺𝗺𝗺 gave the city's bylaw update at the weekly press conference. Largely, the overwhelming vast majority in Brampton get it. But there are still some idiots among us. The lowest of those yet again assaulted a Brampton bylaw officer last week. Most doing what is needed. However, Singh noted,
we continue to see large social gatherings take place in homes and sometimes in retail locations such as warehouses. So far in 2021, Brampton responded to 2,200 complaints about illegal private gatherings, and in some of these instances, our officers face verbal and physical threats and assaults.
Peel police have apprehended, arrested, and charged the party who is alleged to have assaulted the bylaw officer. Singh also noted that the cities of Brampton and Mississauga have now formed a coordinated response with Peel Police. As soon as this weekend, these teams will deploy to any reported large gatherings. The object, as always with the bylaw department, will be compliance. But if they can't get compliance, Peel Police will assist in laying charges and will lay any of their own that they are responsible for example, criminal assault of a bylaw officer. Late in the week, CTV News reported that a Toronto law firm, 𝗕𝗿𝗺𝗺𝗺 Law, had sent out a news release advising against holding large parties because, according to the firm, that leaves clients open to ruin. 𝗕𝗿𝗺𝗺 is already fielding calls from people who went to parties and now want to sue the people who held them. That's the Brampton Now Update for this week. Please hit subscribe on the Brampton Now Update channel on YouTube at the link in comments, or follow #MarshallMinute. The Brampton Now Update, your weekly reliable source for all things Brampton. Your comments and suggestions are always welcome, and if you've got a Brampton story to tell, get in touch with me through the channel you're watching on right now. I'm Bruce Marshall. Thanks for watching Brampton Now Update.
Quiet, numbskulls, I'm broadcasting.